Hello, hello. Is anyone already with us? No. Okay. I forgot I can see how many people are in this.
No.
No one's here. Oh, we have 16 people now. Hi, everyone. How's it going? My name is Michael Bernal. I'm not sure how many of you were with us last time, but I am the Western Region representative for Redcord America. For those of you who were with us last time, first want to apologize for the technical difficulties we had, hoping that won't happen again this time. But you might remember there is the chat function on the right. I'm not quite familiar with how it works on mobile, but it's pretty easy to find. But yeah, let's just have, if you guys can just tell me where you're tuning in from, that would be great just to get started while we wait for a few people to come in. And there's a little delay on the chat, so I might be waiting for a little bit. Hello, Michael Garrett. Hey, Christian. Lisa from Michigan. All right. Miami. Hey, Michelle Harris. Hey, Catherine. All right. We're all over the country so far. Hey, Elsie. Good to see you're with us today. Michigan, Denver, Toronto, Halifax. Very good, very good. I wish I had a few more people on my side of the country, but it's a little early. A lot of PT still working. But yeah, so I guess we should get started. We've got a lot of people with us and people will hop on late most likely. But so as you can already see, I'm joined here by Gab and Allie, two of our most experienced NERF users. You guys want to introduce yourselves again?
Yeah. Go ahead, Kim. Sure. So I'm Gabrielle Schreier, and Allison's here too, and one of my clients has agreed to come in today to do this treatment session. We have been using the Redcord since 2007 when it first came to the US, and have sort of been immersed in it ever since. Started training right away to become instructors in the work. And I believe we were NERAC 1 instructors starting 2010, and then have just continued to grow with it. We use it every day in the clinic. I don't think I could be a physical therapist any longer without it. But still use all other traditional PT knowledge that we all learned leading up to it. So today is going to be, you'll see a little bit of clinical reasoning, but that'll be more kind of telling you what I've learned along the way already through treatment. And we're going to do a treatment session, so hopefully it'll be organic for you to watch, but hopefully enough information will come across in the session. Ali is going to maybe talk and explain a little as I'm doing treatment of why I'm doing what I'm doing or what we're doing, so that can be also expressed through the treatment session.
Oh, and one thing I wanted to add, you're welcome to submit questions during the treatment. Ali and I will be keeping an eye on it, so she might be able to answer it just intermittently as we're going through it. If not, we might have some time at the end to answer questions. Otherwise, we might just kind of gather them up and do another webinar where we can answer questions. Okay.
So before, Tim's actually lying down because that's comfortable for him, but before he gets up and you see him online, I'm going to give you a brief history. I first met him, it's been maybe about a month ago at this point. So the history was that in May of 2017, so really starting, I guess, about 8-9 months ago now, he was doing CrossFit a lot and was noticing a lot of right hip glute pain that made it difficult to even get through a class. So, and he's had a long history of working out and being fit and understands his body quite well. So decided to take a little time off to see if he could give it a break. Went back about 2-3 weeks later to a CrossFit class And in that first CrossFit class, basically felt it right there and reports I blew a disc. It was on the left side, and MRI shows, I have the MRI report, which I saw upon evaluation, that there is a 4 millimeter bulge with a 9 millimeter impingement at left L5S1 impinging into the nerve root. And his symptoms were exactly that, with left-sided glute pain, down the hamstring, calf in a knot. So it was very typical radiculopathy symptoms. He did go to physical therapy at the time somewhere else and improved as far as those symptoms, but started reporting bilateral deep psoas anterior hip pain. And the physical therapist told him, well, you just need to work your abdominals more. And so he did. He's a good student. And he worked his abs really, really hard, started doing his own thing, a lot of crunches, a lot of flexion and working his abs. And instead of getting better, basically it started sending him to a downward spiral of just this deep anterior pain in the psoas/abdominal area. It has now focused more to the right. So it does seem back to possibly that original injury that was brewing. But got to a point where unable to walk basically more than a block, unable to stand for very long. Function has completely.
To the point where it couldn't stand or walk like at all.
At some point.
Yeah, at a certain point, yeah.
Actually, to the point where he couldn't breathe.
Yeah.
He told me about he couldn't breathe. Diaphragm was so locked up. So anyway, by the time he came to me about a month ago, that had improved. But by the time I saw you a month ago, couldn't walk more than a block, unable to stand, has had a change where he works from home, unable to go into work. Nights, has to prop himself up in certain positions, wakes up in the night with spasming in his legs and abdominals, etc. So severe loss of function in daily life. We have made some improvements in the sleeping is better.
Yeah.
He's able to sleep longer in the night and isn't getting the spasms as much. Strength has improved. Through weak link testing and treatment, strengthening has improved. Walking, unfortunately, is the one thing that has not improved very much. A week or two ago, it seemed like it was a little better. This last week, it has gone back to where just getting from the car to up to therapy can be a problem. So that's where we're at today. I just did a quick screen and we'll do it again so you guys can see, but things are also changing every treatment session. So what we've done so far is at the beginning, I did lumbar settings, and we did a few sessions of those. We've tried an SI belt for walking. Hip abduction seems to help. So we've been working his right glute med, which has gotten much stronger. And left pelvic lift because the right core was difficult. So that's sort of been the majority of treatment, a lot of core work in length instead of in flexion, which was very hard for him to do because that's not the way he was used to working his abdominals. But all of that has gotten better. So that's probably a little bit of what you're going to see today. Not sure, depending on what we find. And we'll go from there. Okay, so let's stand up.
Yeah.
When you're on the side of the table,
Okay, come over here.
Yeah.
Meaning when I go to treatment or even now. Okay. All right, so I'm going to have you start with, I want you to rotate your body and look toward the back wall. Take your hips and shoulders with you. Yeah. So we want to see 90 degrees of shoulders and 45 of hips. He's not going quite far enough. So that's really where I'd like him to get to. Any discomfort?
No, that's okay.
All right, and go the other way. And this side's a little better. That feels okay?
Yeah.
All right, so I'm gonna belly squeeze here.
Yeah.
You're gonna go to the left again.
Okay.
Don't move your arms around me. Okay.
Yep.
Just turn. Tell me if it feels different this way or not.
Hard to tell. I don't know if I'm getting more or not, but
Hard for me to tell,
Feel-
so I'll speak up.
Doesn't feel any different?
Do that again.
It feels easier or less discomfort?
Might feel a little bit easier. I mean, in general, that sort of right now, because I've even experimented with an ace bandage around here because it just feels a little bit better. So
It feels better when you get that
yeah,
squeeze.
so I get that squeeze. Yeah.
Okay, lift up on your toes.
Yep.
And you're going to turn to the left again.
Okay.
How does that feel? It looks easier?
Yeah. I don't feel like I notice anything.
Okay, come back.
Yeah.
All right, squeeze out against my hands
Okay.
and do it again.
yeah, it's hard to tell.
Okay, so no significant difference. All right, what about this? Go into extension.
Okay.
And how far back can you bend? What stops you?
Just this feels
Okay,
as
come
far as
back.
I can go.
All right. You can do the same things, okay?
Yep.
Okay, go now. Not the same, or
Feels like the same.
okay. And then the same thing. I'm going to squeeze out
Okay.
and go back.
Feels like the same.
All right, and up on your toes. I don't know.
Yeah.
I'll balance you here.
Yeah.
Less or the same. It feels like it's hard.
Less or the same? Meaning
Yeah.
you go not as far.
Meaning not as far, or
Okay.
or maybe just as far.
All right, bring your feet all the way together.
Okay.
Cross your arms. Stand on your left leg,
Okay.
and then stand on your right leg. Okay. Do your left leg again. All right, and on your right. Okay. Okay. And then how is forward flexion? Can you bend forward, touch your toes?
Ooh.
Yeah, I know.
I don't think I've done this since
Since
Since May.
Okay.
This is a scary one.
All right. When you and I haven't done this,
Yeah.
but your others aren't looking. So I want you to just go as far as you feel comfortable.
Yeah.
Probably about as comfortable.
Okay, come back up.
Yeah. It's just real nervous with that one.
Okay.
For sure.
Tell me if this helps.
Yeah, I mean, it does. It feels like it helps a little bit.
Okay.
Also,
Alright.
it feels a little weird.
When I squeeze you so hard.
Yeah.
Okay.
No, it wasn't that hard.
Just
I don't know.
So maybe, yeah, if you want to explain what you just did while I'm getting set up.
yeah. So looking at some of the functional movements, we're trying to see if by accessing any of the myofascial chains, if it changes the movement. Today, it didn't look like anything was specifically glaring as good. In the past, belly squeeze was really good. And hip abduction. He did still report he kind of likes when he has the belly support. I haven't done a setting in a few sessions, and I'm thinking I want to go back to that just to see if it does help with the walking and this feeling of support through the lower abdominals that he feels like he doesn't have. And I'm going to choose right side lying setting since the pain is primarily on the right side. And we have discussed sleeping positions and positions of comfort. He likes stomach, actually is one of the best to release this right hip, but he's not comfortable being on his stomach in the Redcord, which we've gone through together. So right side laying is what we came up with next. Okay, so you're gonna line your right side.
Okay.
Yeah.
That's
left and then
yeah.
foot.
Yeah.
There was one that we open the doors, it was loud.
Yeah, I think you drove it.
And then I have this arm thing here. I want to ask you whether it's all good. Yes. She's tested that on.
So there's a couple questions that have come up that I'll just address really quickly. One of which was, what was she actually doing in the functional screening? And Gabrielle sort of let you guys know. So she, with belly squeeze, is testing deep core intrinsics. And then by having him come up on his toes, we're testing the posterior back line. With active abduction, we're testing the lateral line. She did not test the deep front line with adduction because she's done that before with him and it hasn't been helpful. So what else did you test? Oh, and she's tested his weak links and adduction and they weren't like weak before. So we're kind of just going by previous history with her treatments thus far. We just wanted to show you that she did do a brief screening, but there's other things that came into play with her clinical reasoning as to what she wanted to show you guys. What was the other question? Oh, so now she's going to deep core intrinsics because abdominal squeeze felt good to him. And normally we'd go prone, but he doesn't like to have his head in the harness prone. So she's going with side lying on the right, since if they don't have a preference with sleeping on either side, you go with painful side down. Hopefully that answered most of those questions. The ball squeeze was not tested because she's already tested weak link tests on adduction and they were fine. So we didn't do ball squeeze in the screening because she knew that already. So here's the setup for supine, for sideline setting of the lumbar spine. So at the head, you have the cervical harness with two long black bungees. At the thoracic spine, it's on solid ropes. At the lumbar spine, it's a long red, short black bungee. And at the legs, it's solid. So she's doing the sideline setting. If you guys remember, for those of you guys that have taken Nurec, it's a 2-minute timed test because the core intrinsics are deep stabilizers. They're more tonic in nature, so they're on for longer periods of time. So it's a time test versus just a active strengthening test. The Nurec Institute, in Norway, has just found 2 minutes is the optimal time. That's why it's the 2 minutes. Okay. I wasn't necessarily going to talk a lot, but I will entertain you as you observe. Yeah.
So
come over here. This is the best place to talk.
So the reason that we didn't do prone lumbar setting, which is actually what I think would be the best choice, is when I was going to do that the first day with Tim, he also mentioned that he suffers from claustrophobia. So we can't really go into that position. So even this is difficult for him. So he's just taking a little vacation. Done.
All right, and so any of you guys that have taken Nurec, and for those of you that haven't, it's always really important that you make sure all your ropes are taut, that all your bungees are as taut as they can be before you take the table away, so that the patient is fully supported when the table is not in the up position. So he's going to basically be fully suspended. His body weight is going to be fully suspended by the ropes. So we're taking the gravitational aspect pull off of the musculature, so we can just truly isolate the center portion of his core musculature. We could use the stimuli. We're just choosing because some people haven't taken Nurec at all to not add more information to the equation. But during her treatment session, I'm sure Gabrielle uses the stimuli. And it's totally appropriate to do that with this particular setup. And you could, most likely, we would do it here at the pelvis, but you could do it at the legs as well. Good questions. Some people have already been through a lot of Nurec training. I can tell by the questions that are being asked. Great, great, great questions. Oh, his lower extremities are supported on a solid strap, a solid sling, and solid ropes. So she's now putting him what's called the neutral zone. So it's just a slight range of motion differential where the only thing that can actively hold the position is the musculature. So the ligaments and tendons are still on slack. And she's just isolating the deep core intrinsics right now. And he's going to be asked to hold it for 2 minutes. He's going to let her know if he has pain. If we have pain, we would either try to perturbate the ropes to change it, or you would denote the time and stop the treatment at that point and just try to get him further along each setting to tolerate more of it. And he will also let her know if he has fatigue.
So I just put him in the position and had him hold for a little bit. There was no pain, at least not that he told me, or fatigue. However, I did feel the global muscles, the obliques, want to work really hard. And this has been some of the problem that we've been dealing with. So I'm going to keep working with him to try and turn those globals off so that he can get into the deep stabilizing system instead.
So someone did ask about the stimuli. Do you want to bring it into it or no? Do you want me to grab it?
Maybe. I mean, I thought about it when I was sitting up.
All right. Well, whoever asked that question, you were very clairvoyant. So I'm going to go grab the stimuli.
I mean, I may not need it.
Okay, I'll just
So this thing loose if you tell me.
Yes. Hold. All right, relax. So I want like half of that.
Okay.
Okay.
Yep.
no, because prone you hold this
So just think to hold this position, not necessarily activate the muscles.
So one of the
Right.
questions
Yeah.
that just came through was the positionality of the sling at the pelvis. So, and if it was the same as prone, somebody asked. So in the prone setting, you actually fold the sling in half and it's right above the ASIS. In side lying, the sling really is actually between the iliac crest and the greater trochanter. So similar, but in prone, it's a little higher up and the sling is folded.
He's actually doing that.
He's doing better, so we're not necessarily going to add the stimuli. He's able to allow the global muscles to not be activated. Mm-hmm.
What is the cueing being used to focus on the intrinsics versus the global?
I mean, cueing, a lot of it might have to do with her perturbation to get the mechanoreceptors to fire, so she doesn't necessarily give him a lot of cueing, but you can ask him to activate his pelvic floor. That's a good cue. Other than that, you just want to make sure that they're not doing a large contraction. So you ask them to hold it with as little effort as possible. To them, it might not even feel like a contraction, but it is.
And that was the experience we just had, is I put him in the position, and when I said hold, I felt under my hands quite a lot of tension, like he's trying to do too much. And I said, I want like 50% of that. It was too much. And then this last one was much better. So one of the cues also is just hold this position with as little effort as possible as I take my hands away, not necessarily try to get into the position.
Yeah.
Also, you'll know if they've overdone it when they relax out of the position. They should only move about 2 millimeters. So anything larger than that, you know they're activating their global musculature and not just the deep core intrinsics.
Keep breathing. And fold it out.
And you guys can see how careful Gabrielle's being not to influence his movement at all. You basically come in, do the setting, and you need to kind of just melt away from it without interrupting the ropes at all. Because once you hit the ropes with your own body, it will have an effect on his setting. So you as a practitioner need to be very, very dainty as well with this. You guys can see she's perturbating the ropes here. So when you're perturbating for just local activation, it's a very, very soft, almost like fluttering, like a butterfly flapping its wings. It's not a strong vibration contraction. When you're working the myofascial chains, then you're able to exert a lot more energy and perturbation into the ropes. So are you on the second?
We're on the second set. I'm going longer. I'm shooting for 2 minutes.
So with these settings, again, you want to do 2-minute trials of them or it as an exercise session. And after every third session, you're going to reassess because we want to see if we're on the right path, that this is what he's needing, if this is helping. If it's not, we need to move on to something else.
Good. So the relaxation was really good. It was small. Every once in a while, I stopped the perturbation just to feel what was going on in the global muscles, and they're staying more relaxed. And I wanted to ask during the treatment how he was feeling, but I also didn't want him to talk. So, any fatigue?
No.
Is it hard for you to hold that position?
No, it's sort of one of those, in the hold, I start wondering, am I still holding?
Right.
And
Okay.
it isn't until we're done that I realize, oh, I guess I was.
Right.
So it kind of feels like I'm not
Doing
actively
anything.
doing anything.
Yeah, that's very common for your patients to say, I don't know if I'm still holding it, and just tell them it's fine. We'll know at the end, but bottom line, for the most part, they do hold it. So just reassure them that they're probably doing the right thing.
And also, you guys cannot see this, but right now his body has changed and adjusted. So he's rotated back now where he was straight. And that'll happen through the treatment because his body is adjusting. So now I'm going to add a little more bungee support on this side. And drop this side just a tiny bit. So that he's straight again. And we'll do one more set. And then we'll move on.
Okay, so we're going to do one more set so you guys can see it, and then we'll probably reassess some of the findings from her initial functional assessment.
All right, I want your focus during the set to be on your breathing.
Keep breathing.
Keep breathing
Yeah.
through your belly. Okay. Keep breathing and hold this position. Good.
That question about like perturbate rather than stimula, was that the question you already asked about the stimula?
No, this is a new one.
So someone asked, why are we perturbating the ropes rather than using the stimula? A couple reasons. I said the one already is that we didn't want to bring the stimula necessarily into this treatment because some people have never even been exposed to the ropes. The other thing is that you don't really want to go to stimula right away necessarily, because once you go to stimula and things aren't working, you can't bring something else into it. So if you're getting what you want without the stimula initially, you're getting that he's able to go longer and whatnot, keep going with that. And then when you feel like you're not getting enough bang out of the treatment that you're giving without the stimula, then bring the stimula in.
Also, he wasn't necessarily having pain in the evaluation. He had global muscle activation, and the perturbation did help that. So, like Ali said, then you don't necessarily need to bring the stimuli in.
We don't want machines to take over our occupation anyway, so do what you can on your own first. Although we use the stimula every day, all day, so. So was he getting to 2 minutes on the last one or no? Okay, so he got to 2 minutes on the setting prior to this, so hopefully he'll get to that as well.
His globals feel good and relaxed.
So someone is asking about stochastic resonance, which is a lot about what the stimula is about. So I'm not quite sure what you're asking about in that particular question.
Well, maybe does perturbation also provide the noise?
Oh, do you
Relax.
create that with your fingertips? No, the amplitude and frequency of the vibration that you can create through your hands is not at the same intensity as what you get from the stimula. So the stimula does get stochastic resonance, but your fingertips don't achieve that because of the frequency and amplitude that we as humans can exude on the ropes is not enough. Oh, good question. How much rest do you need them to have between each one? You need to rest at least 30 seconds, just like you do with any of the myofascial chain exercises. So in between each repetition of exercise, there's always a 30-second rest in order for your neuromotor programming, the central nervous system, the peripheral nervous system information to be processed appropriately, and so that your body is able to attain the new information. Okay, so she's done 3 sets of 2 minutes. I don't know if she rested 30 seconds, but we need to get. Yeah, we were trying to talk for 30 seconds, but now she's going to do some reassessments, and you guys will be able to see what that looks like. So,
Yeah.
Before we reassess, we always want someone to go walk a little bit so their body can assimilate the new information. And you don't always want to reassess right away. You just have them go walk maybe to your front desk or walk outside the room. And it's also, you know, a little disorienting being in the rope. So we want them to kind of get back into their body's weight bearing on the ground.
Okay.
So he's walking in the hallway a little bit, and then he's going to come back in and she's going to reassess. And I'm just making sure we don't step on the stimulus cord.
Okay. So walking didn't feel much different. Sorry. Do the extension. Arms up and back. And go back. That does look better. How does that feel?
So tightness
Now
in
you
here.
get a feeling a stretch.
Yeah.
Because you're going a little further.
Yeah.
Okay.
Yeah.
And I want you to do that flexion on the end too.
Yeah, I don't know.
Okay.
Yeah.
All right.
So I don't know if you guys
Yeah.
could see his active range of motion with extension was definitely better. His forward flexion, not necessarily better. So now we're going to move on to do some other things, working through the myofascial chains.
So based on previous experiences in treatment, the weak link tests I want to look at today, because as I said, he does seem different. I want to look at pelvic lift, abduction on both sides, and probably hip flexion. So we'll kind of screen those quickly right now.
I'm going to take this out. Don't be alarmed, Tim. This is coming
Okay.
through.
Okay.
I'll make sure it doesn't hit you in the face. You trust me?
I do.
You let me work on
There it goes.
All right, put your right leg in. Yep. Okay, so this leg's going to be here, which you couldn't even do before.
Oh, just hold it there?
Yeah.
So we're doing weak link testing. She's now assessing his right pelvic lift,
I'll
which is
hold it.
primarily for the gluteals.
Oh, just, oh, like that. Okay.
Yeah.
It also gets the
Push here.
Yeah.
Let's do this.
Yep.
hands to your side.
Yep.
Good. And lower down. I want you to try to reach this a little longer.
Right.
So now she first observed what he was able to do, and now she gave him verbal instruction on what to correct. And she's assessing that.
How's that feel?
Feels okay.
Now she's going to take the bungee support off and see if he can do it without.
Lift that up.
Yep. And down. Good. So right side's good.
So right side is a level 1.
And typically this is his weaker side.
So now we're moving on to the left side.
So lift that up.
He's deviating to the right.
That's straight.
Yeah.
So she's manually and verbally letting him know
And down.
positionally what she'd like to see.
Ready?
And one. Okay. So he rotates down. Do you have that discomfort you sometimes get on the right? with
That
this?
felt.
No, or no?
I think that felt okay.
All
Yeah.
right.
So I don't know if you guys could see it, but what we saw, I mean, he actually looked fairly good, but it's definitely different right to left. And he's weaker on the left side. I shouldn't say weaker. There's a disconnect on the left. So he was dropping his right ilium towards the table, and also both of his legs were deviating to the right. So like a lateral shift of the legs. And because he has a psoas kind of strain issue on the right, she's going to offload his right leg for support since that's not the leg we're working. So she just put a short red bungee and a foot strap, and we're just rigging the right leg up. And now we're working the left glute and core.
And left.
So see, she's perturbating a bit harder now that we're working the extremity. And you want to do about 4 repetitions, 4 times, 30 seconds resting between each set.
One more time up.
Keep the right totally relaxed.
Yeah.
Okay.
And relax. And since this isn't our first, he's resting. Since this isn't the first session, I'm jumping into treatment after checking left and right pelvic lift because this has been the weaker side, so I want to make sure I treat it. Obviously, if I was in my first session with him, I would run through all the weak link tests first that I want to do and then do treatment. So
We have to give him a free treatment. So. Otherwise, we don't get in the air, right? No, we don't know.
All right, lift up.
We're happy to.
Okay, hold this right hip up.
So now she's taking some of the bungee off the right side because that was the side he was having a hard time holding up to see if he could do it on his own.
And down.
Arms okay here?
Yes,
Sort of
for
using
now.
them.
Yep.
You can use your arms.
And
that's fine.
lift.
Yep.
Hold.
So she's helping him come up on the concentric, and then she's taking bungee support
Lower
away, and then he's having to control more on the eccentric because there's less bungee support.
Hold.
So focusing eccentric control here.
Good. Down. Nice. One more lift. Hold. And rest. Good. Okay, so the next set, we're going to do the one where you take your arms here.
Right, right.
Okay.
Yeah.
So now we're adding lat activation to facilitate the core connection and into all the fascial
And we're going to do it.
lines, and we're going to take the bungees away. Because she knows you can do it.
Okay, lift up.
Yep.
So use your arms to pull this down. This.
And
that.
she's correcting
Okay.
any deviations and seeing if he can
Whichever
hold them on
arm
his
you need to
own.
use to get there.
Right there.
Yeah, good. And
Yeah,
down.
yeah, nice. Right.
Yeah.
Okay.
And again. So try to pull this down. Yeah. From your right hip up. That's it. And down. And lift. And lower. 2 more. Good. And down. One more time up. And relax. Good.
You doing okay with this?
Yeah.
Yeah.
Okay.
So we could have added other things. You could have, are you moving on?
Yes.
We could have added hip rotation from right to left to get the ilium up higher on the right. Also, we could have added lower extremity to one side or the other for the lateral shifting that was taking place. So you can do whatever you want in treatment. Once you find deviations and you want to help whatever way you can to augment whatever movement patterns they're showing you that are not symmetrical, and then you try to get them as symmetrical as possible. Yes, you're looking for level pelvis, you're looking for torso levelness, evenness of the scapula on the table. So it's not just the pelvis, you're looking at the whole body. So when you're working the lower extremity, in particular, the pelvic positioning is, yes, of utmost importance. You also want to make sure they're not going into lumbar lordosis or just maintaining a normal curvature of the lumbar spine through all of it as well. So we're doing side lying abduction, weak link testing. He's laying on his left side, so we're testing the left side first. So the height of the rope is the greater trochanter of the top leg to the lateral malleolus of the bottom leg.
Yeah, good. Yeah. I have him uploaded to start because he doesn't like this.
Okay. She already kind of offloaded him initially, more so than you would, because he doesn't like to be side-lying. So
Yeah.
she knows that from past experience. So he's a little higher than he normally be off the table from the start.
Good.
Right there, yeah. My hand's okay.
Yeah. You feel this muscle right here?
Yeah, I
The
think
right finger's digging in.
yeah.
And down.
You can put this hand on there. Just long.
Got it.
And lift. Good. And down. Okay, so I'm going to try this without the support.
Okay.
Lift. Okay, and lower down. Good.
Keep your head relaxed.
So,
I was just cueing him to keep his head relaxed. A lot of people will start to use their neck musculature to facilitate the movements. I mean, it's part of the lateral line, but you want to make sure they're keeping their necks relaxed.
okay,
So did you give
other
him a 1 on that?
no, not quite. I would say a 0 F.
0 F on that side. And for any of you guys that took NURAC a long time ago, there's a whole new grading scale. So let us know if you guys, let Michael know if you don't have that so we can get it to you.
It's a 0 F or a 2.
It's a 0 F, but in old NURAC times, that would be a 2. Don't want to confuse you guys, but. But we are teaching NURAC 1 on February 2nd. So if anybody's interested, we will be teaching here. Or if you've taken it and you want to audit it, you can come.
And down. How's it feel compared to the other side?
I think stronger.
Yeah.
Yeah.
It
And
looks easier.
this is the one we've been working.
Yeah.
Uh-huh.
And down.
It looks stronger.
Okay. Go up. Yeah. So
So
this
when-
side's a 1. And
Yeah.
So his right side's the one is actually stronger, but that's the side initially she's been working. So she's just retesting, meaning from subsequent treatments. So his right side has actually gotten more connected
it
with
used to
treatments.
be a 0. He had pain.
Yeah.
0 P on the right.
Mm-hmm. And now he's a
0
1.
F on the left. So now he's a 1 and
Yeah.
he's still a 0 F.
Yeah, so that's good. Tim, you've made improvement.
Good.
Yeah.
So before, I don't know.
How often is he being treated? Twice a week, right?
Yes.
He's coming in twice a week, but again, he only started about a month ago. But he's also driving quite, if you guys aren't from here, most of you probably aren't, it's quite a ways to get to us from him. I would say, what, Tim, 45 minutes?
Yeah, today was over an hour, but sometimes it's only just like a half hour. You know,
Yeah,
it's LA.
It
So.
depends, yeah.
Do you guys have questions? I think
I don't think I have more questions right now.
Okay, fine. Don't worry about it.
In treatment, you'd be able to go to the bathroom, so you should go to the bathroom.
Well, I was also gonna, I want to do standing. So maybe
Okay, we can move the
do that
table,
next.
but we're gonna just move the table. So why don't you go to the restroom?
For the computer.
I'll do real quick.
Yeah. I think we should just move the table.
Okay, all right.
He's gonna go to the restroom. We're gonna move the table because we're gonna do some standing work with him. Here. So,
Yeah.
we're gonna get him out to the restroom and we're gonna move the table real quick and get him back in the ropes. What do you do standing like coordination?
I'm gonna do, yeah.
So if you guys have any questions, right now is a great time for us to answer them. Send them in if you have any more. You can do access. And we're gonna bring out the access. Do you want the stimulant? It seems like people want
No.
a stimulant.
He doesn't have pain. Sorry. We can do a stimulant webinar.
Want to see if there's any questions though?
Stay in here.
No, leave it in here.
I think so.
This is the table cord, right? I don't want to plug in single micros.
Yes. All right, so I know from treating him that standing core work, well, standing arm work is really all core work for him because he's been so flexed. So when I'm making him work upright, it's really difficult. It's a lot of work. So that's where we're going next. All right. One is this one is not as high or tall. All right. Come over here.
So now you got about 15 minutes.
Yeah, that's why I wanted to move on to this. Okay. All right. So a little pressure
Yep.
into it.
Yep.
You're going to lean toward me. Remember, don't let
Yeah.
your hands do
Yeah,
that.
yeah, yeah.
You should-
To the 90?
Yep.
So she's doing standing forward lean, which is, I think she already told you, is definitely a core exercise, especially for
Yeah.
him, because he's used to being flexed and he needs to be in a neutral position. So we're working the ventral fascial lines here primarily. And as anyone who knows about the myofascial lines, you can only bias a line. Everything is working. His posterior line, his lateral line, deep front line, but this one biases the ventral.
So where do you feel this? Oh,
Yeah.
good. And rest.
That's basically the only place I feel it.
All right. Take a little step backwards. Not too big.
Yep.
So we're going to keep grading up here. No, I need to.
Oh, sorry.
All right. Go again.
Okay, same thing, right?
Yeah. Hands separated, elbows toward one another.
So he has really good form. I don't know if you guys can see, but basically you only go out to 90 degrees forward flexion of the shoulder girdle, elbows bent.
More challenging.
At the very end
Yeah.
of the range, right there.
For the lumbar spine setting, you want to use, there's different engines. So you have 1, 2, and 3. So you probably would use either 2 or 3, and at 50 hertz would be the setup. And you could have all engines running as well. So, but 50 hertz would be the frequency that you would most likely use. When you're doing lumbar spine, 50 hertz is primarily what you use. When you get into the lower extremity, it can be from 50 to 70. And when you're using the stimula for the cervical spine, it's always on 1 engine, level 1, and at 99 hertz is where you want to go. But just remember, for those of you who have been to stimula, that you go with the patient's level of comfort. What feels the best to you is really what's most imperative. So someone's asking, I would love to know some of the home exercises to incorporate the exercises done using Redcord. I think that's a difficult thing for us. We can definitely do that. We could do a whole webinar or some of a webinar on home exercises, but for right now, I think it just is not appropriate to go over that right now.
Good. Still core primarily?
Oh, yeah.
So someone's asking, I believe your question has been answered at least twice already. To recap, not all viewers have learned to use the stimula. Oh, why we aren't using the stimula? Yes. Again, I'll recap it. Thank you, Rebecca, for putting in such a succinct form for me. But we're not using the stimula, one, because some people have never even seen the ropes, and we didn't want to complicate things too much. We just wanted to show, you know, the fundamentals of NURAC, which is already completely complicated.
I also have to, sorry, I'm just going to interject. I don't know that I would have brought a stimula into this treatment anyway.
Because he's not having pain.
He's not having pain during the treatment. And I'm able to get what I'm looking for in my treatment and in the setting without bringing the stimula in. So it's not necessary right now. You don't always bring the stimula in because you have it.
She agrees with me. We don't need machines for everything. We can do it.
Don't put your chin down when you go down. Yeah. Good.
Do you have a position where we can get eccentric hamstring activation? Yes, absolutely. There's a specific exercise called supine bridge, which activates the posterior line, specifically the hamstring, and then there's a specific hamstring exercise as well. And by utilizing the bungees, you can facilitate or bias the eccentric aspect of the hamstring contraction.
I've been only doing a couple sets.
Yeah. So yeah, Gabrielle's just doing a couple sets of each exercise just to show you guys the variability. You know, she's going through a lot more variations, but again, you want to do 4 sets, 4 times, 30 seconds rest in between, and then reassess.
Yeah, typically, but actually with him, all the upper body is core work. So I'm actually just doing 2 sets, but I'm doing many different upper body exercises because really mostly where he feels it is his core.
Which one is this?
I'm going to do push-ups.
Right.
So take a little step back.
Yeah.
Lean forward.
Lean forward, the kind of straight arm into it.
Yeah.
Is that?
Good. Stop there.
Yep.
And you guys see she's on the axis. So the ropes in and of it themselves are unstable, and now she has them on the axis, which those ropes move as well.
Yeah, so at the top, I'm holding myself now.
Yes.
Yeah.
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 Gives you the
That's hard
push-up.
right there. Yeah.
Okay. And is this whole movement challenging or easy?
It's challenging at the top right there
Okay.
when I'm taking it all. And then just sort of not easy, but
Okay, good.
Yeah.
Shouldn't be.
yeah.
A couple more. 2 more.
Okay.
1 more.
Somebody likes us. You guys are great, it says. Like the comments.
Stand up.
Karen, finish your question though. Is there a reason she's gone to upper body work rather than hip flexion?
Not arms.
She was talking about going to hip flexion. Is there any reason why you went here first, or you just because
I
of?
had 15 minutes left, and I think that he gets better results from this in upright.
So you guys have to remember some of the decisions Gabrielle is making in this particular session is because of previous experience with Tim and what she knows works best for him. And she wants to give him the best outlay for his body this evening. So that's why, but we definitely would go to hip flexion with him. It's a time warranted.
You're going to push it with rotation.
Yeah. So like this.
So the beauty also of the axis is going into three-dimensional movement to really get all the myofascial chains working in synergy.
Okay.
Yep.
Try not to necessarily come up so high each time. Stay there, and then twist there. Just hands. And let your hips go. Yeah. That's it.
Am I twisting better that way?
Yes.
I feel like you can hardly twist this way. That's what it feels like. I don't know if that's actually happening. This feels like
This
I
is
can
easier
twist.
for you.
Then this it feels like.
Gwendolyn said, I like
Straighten
that.
your left arm.
I don't know if she means this particular exercise or not.
There.
Yeah.
What's stopping you? Can you
I know it feels like the hips. Like here I
Here,
go roll around.
three.
This,
Just push this arm like crazy and let this go.
yeah. Weird.
Good. And
It almost feels like it's shadowing what happens when I walk.
well, also when you're standing,
Yeah.
it's harder for you. You kind of told you do this thing with your
Right.
hips.
Yeah, you told me.
You
Yeah.
poke forward in your rib cage
Yeah.
when you rotate. Although you weren't doing it as much today.
So this is nice for him because when he's walking, he has very little pelvic rotational movements and reciprocity through his pelvis and lower extremities. So he was just saying he could feel the limitation in his rotation. So this is nice on the axis to really get into rotational patterns. And even though we're working upper extremity because it's closed kinetic chain through the floor, his whole body is going through a movement pattern or patterns.
Pain or just hard?
I'm just like, it's
Yeah.
not really working. Not big, but just like here I can rotate. And then
Transfer more weight into your right leg.
into the
Right.
leg.
Yep.
Wait, let me see.
Let's just do that direction. Wait.
Okay.
Yep.
So he's having a hard time rotating his pelvis to the right.
My weight's on my left.
You're going to the right, you feel limitation on the left. or
No,
the
I'm saying
right
my
side?
weight's on my left.
Yeah,
Okay.
and you need to bring it more
To
over.
the right. Yeah, that's what I was saying.
Let's see what it feels like out here for a second. Yeah.
Oh.
Okay, just take a little bit on the head.
Keep your knees straight.
Wow.
Two more to the right only.
Okay.
So now
There we
she's really facilitating that right side.
And then
Right.
Yeah.
Good.
She's helping him and she also motivated and just focusing on that side. Bye, Karen. Karen's leaving. Bye, Karen.
I guess some people.
Yeah. Okay, so we're gonna kind of just do a quick reassessment, see if any of that had positive influence on his movement
How do you walk
patterns.
a little?
Yeah.
See how you walk.
He's just gonna go walk real quick and come back. So he's just walking. You know, Tim, because he's so strong, I mean, there's definitely weak links and asymmetries, but he's really, really strong. So he's a little trickier because we're having a hard time figuring out what's best to work with him. But functionally, he is definitely improving. It's the walking that seems to be the hardest.
And he wasn't as strong when I started,
Right.
meaning
There were
the form
weaknesses.
wasn't there, right? It is now. He's really in tune with his body, so he's been a fast learner, which has been a little bit of the confusing thing as to why the walking isn't better, because the functional tests are, and the weak link tests are. So, all right, try this one again.
There's this.
More pulling.
Yeah, a lot of pulling up that
Yeah,
upper.
the range keeps getting better, so you're getting more
Oof.
pulling.
Yeah.
Okay.
Yep.
And let's do
Yeah.
this.
Yeah, that's mostly limitation. Well, tight hamstrings and fear. It's
Okay, but I
a
think
deadly
that was
combo.
a tiny bit better.
Yeah.
All right. You want to go lie down? I'm going to do the walking.
Oh, okay. Yeah. You want to
Because
step
I
up?
think.
Yeah.
Yeah. I think we're going to wrap up.
Yeah.
Thank you so much.
No, thank you.
So Tim's gonna exit the room. We'll kind of wrap things up here, so.
Answering questions while I'm-
Sure. I don't know if there's any more questions. Do you guys have any more questions? I know that, firstly, I don't know if anyone thanked you guys for all joining us tonight, but thank you so much for joining us. Hopefully, for those of you who've never seen it, it sparked an interest. It's amazing work. And for those of you that are doing it, continue to do it. Gabrielle and I are always here. If you guys have any questions, feel free to contact us. Michael has our contact information. We just want the methodology to get out there and for physical therapists to know about it, because we just so believe in it strongly and think it's amazing. So we are a good resource of information and questions being answered and whatnot if you need it.
I was going to type my email address, but if anyone doesn't have my email address, I'm going to write it in the chat. So you guys are welcome to send me any questions as well. Hey, Elsie.
All right,
Okay.
Elsie.
Well, I'm gonna finish it, and if you guys have any questions that you want to submit, email me or email Allie.
There was a
and,
question up there.
Oh, there was one.
Yeah, right here.
Oh, it's
Lena, he didn't have pain with forward flexion. He said that tight hamstrings and fear were what were keeping him from moving forward more.
okay. Well, thanks so much, guys. Hope to have you
Thanks,
at the
you
next one.
guys.
And as Allie mentioned, our next NERAC 1 course is February 2nd to 4th here at Core Conditioning. But yeah, hope to see you at the next webinar. Oh, did we say that? Well, it'll probably be in about 2 or 3 weeks. You guys will get.
If you guys have any ideas for webinars or things you'd like to see, we can hit the home exercise thing, maybe we can do, but send us any thoughts about what you'd like to see in webinars. We're more than happy to try to accommodate your requests.
All right. Thanks, guys.
Thank you.